When I arrived, I wasn't conscious, so only for like 24 hours. So when I came to, I was quite confused. I was obviously on a ward, but that was about all I knew. So I was quite uncomfortable with the fact, disorientated, definitely confused. I knew my name and the basics that you'd expect me to know. So I needed quite a bit of reassurance from the staff.
I felt very anxious and unsure of exactly what was going to happen. I'd spent quite a bit of time in another hospital, and coming to the new hospital, I felt I didn't know what was going to happen, and it was important that I was reassured, and that, because that anxiety can obviously affect people's health.
I think it was patience more than anything, because I was in such a turmoil. It was a shock how it happened.
I needed quite a bit of reassurance just to tell me I was okay, and then for someone to explain what had happened to me.
From carers, I think patients need understanding, honesty, integrity, and the willingness to work with that patient and not to be standoffish, and to build a rapport, understand what the patient's needs are, and reassure them that things are good and that things are moving forward, because it's easy to forget how frightening it can be for some patients to go into hospital.
Sometimes I feel the staff need to work harder with those people to get to know them. I was very much more wanting to talk to them and wanting to have that human contact, especially because COVID had gone on at that time, where I spent long periods of time being isolated.
Just the presence of someone being there, but just the fact that when somebody went past, they said, "Hello, how are you? Are you all right? Do you need anything? Is there anything we can do to help you?" That was a big comfort and reassurance. Good care is all-round care. It's someone showing to me that they care about me, that my medication's on time, that if as in my case, I had to be turned to start with, it was done on time and not as an afterthought, and basic nursing care in all sorts of ways. Someone just come round and check, are you still all right? Are you still getting the things you need for you to feel all right? Is there anything else that you need? And I think perhaps in that first week, that was what I needed most.
There can often be times when you're in hospital when the wards are arranged in bays, as they often are in lots of hospitals now. So you might be in a bay with 6 people, where you don't see members of staff because they're busy doing other things in there. And one of the things I found really useful is that as you got to know a particular member of staff, they felt confident about coming in, and they might just sit beside you or sit in the bay, typing up notes or things up there, just so that there was their presence, and if someone wanted to ask a question, they could do so. It was that feeling of knowing that someone was around, and it was that further caring.
Important that how the nurses were going to be with me, and some nights, particularly the nights, I was buzzing for the nurse every hour. The nurses to be very patient with me, because I was not awkward, but I was needy, very needy to start with, because of what I've got wrong with me.
The nighttime can be even scarier sometimes, and it's really important that the consistency of care at night is the same as it is in the daytime. But it's really helpful if they're coming into the bay, just a general, is everyone okay? If everyone's asleep, obviously you don't shout that out, but if it's obvious that people are awake, You may just go up to an individual and sort of quietly say, "Is everything all right? You know, do you need anything?" And it's that, again, that reassurance that you get.
They were absolutely marvellous, and they turned out after a few days, I felt like they were friends instead of nurses, and that we're all calling each other by Christian names, and it was just fabulous. It really was, yeah.
Remember, you're not just a number or a disease, or as in my case, operation. I'm a person, just like they are, and I need to be treated as a person.
But I would certainly say that we can all improve the way that we deal with each other as human beings. You know, me on my everyday to life, it made me think about the way that I sometimes talk to people. It made me think, yeah, that's probably not a good way of doing it. And I think that we need to step back and think what I say to a patient can have a long-term lasting effect. And it may be sort of a flippant comment, or it may be a sort of thing. We need to think that that person is vulnerable at that moment in time, and they'll take that very much to heart. What you may think is a bit of a joke be misinterpreted, and I think that it's not having fun and not having a banter going on, but being very careful on how that's used, and being very careful, and it's building up that relationships and confidence with people that they then accept you as a human being, and vice versa.